Good evening, everyone. My name is Patrick. I'm a student physical therapist, and we're here today with my community partner, Brennan. How you doing today?
Doing good.
Doing good. All right, the purpose of this video is to demonstrate his repetition max between 6 and 12 reps. There's a lot of good literature that shows that when strength training, 6 to 12 reps is a good way to promote strength in a proper way. Definitely don't want to be doing 1 rep max with some of our patients because that could exacerbate some of their symptoms. Brennan presented with right bicep tendonitis. In the clinical room, we performed a fair test of him flexing his right elbow against gravity, no issue, which led me to perform a manual muscle break test, which I was unable to break him with a score of 5 out of 5, which he was unable to do initially. So we're very proud of where he's got to this point. In regards to further progressing his intervention, we are now focusing on strength training to further strengthen the musculature of the elbow flexors so he can make his way out of the clinic and back to returning to some of the activities that he likes to do. So before we shot this video, I didn't want to exacerbate any of his previous tendonitis, so we didn't overshoot the weight. We started out with 25 pounds. He was able to move that weight pretty good, which we were happy to see. However, we're trying to get a window of 6 to 12 reps, and we found that the 35-pound dumbbell is a good range. He was on a little bit of the lower side. However, it's a good weight to challenge him to promote good muscle strength and endurance. All right, you ready to go? Mm-hmm. Sounds good. So just like we talked about before, make sure we got a nice wide base. I don't want you compensating, lean in, sticking your chest out, be a nice true deflection. All right, I got you. All right, there we go, come on, good job. That's 1, keep going. Good job, that's 2. Good job staying sound with your body. Come on, that's 3. You got 3 more, I know you do. 4, come on, make sure we're taking nice deep breaths. 5, keep that elbow by your side. 5. Come on, come on, come on, come on, come on. 6, we're going to failure, we're going to failure. I'm here, I'm here, I'm here. Come on, that's good. Good job.
Thanks.
Yeah, that was great. So as I kind of touched on before he performed the 6 to 12 rep max, that he was on the lower end. Seems like he kind of used all the gas he had in the tank. But how did that feel, Brennan?
Oh, good.
Nice. So that's a good way to find where the patient is in the strength in regards to performing a rep max test. Once again, we don't want to be performing a 1 rep max test because that can kind of challenge the patient a little too much, and it may not be safe to do that in the clinic, and sometimes even outside the clinic where that can provoke serious injury. Thank you.
Thank you.